I think mental health is something that the world needs to do a lot more of. There is no depth behind that relationship.
Yeah.
So from a stupid person, I learned never to trust people anymore. I don't want to do that.
Exactly.
I really don't want to do that.
थोड़ी सी AI की भी बात करेंगे. Yeah.
थोड़ी सी नहीं, बहुत सारी बात करेंगे.
Exactly.
For me, mental health is very simple. It's these two positive words: happiness and peace of mind.
Absolutely.
And it is the lack of these three negative words: sadness, loneliness, and stress. That's it. I, for the life of me, have not been able to come up with a sixth word. For me, mental health is basically just as simple as that.
Got you.
Technology is needed to make it scalable. Number two, technology is needed because people do not want to talk about their mental health. So
Right.
technology is needed to create and provide people with that anonymity,
Yeah, that safe environment.
that safe space that people could, use for themselves.
True.
Number three, technology is needed for solution discovery. In all my research, while of course there is this problem of people don't want to talk about their mental health, what I have realized is many people don't talk about it purely because they don't know if there is a solution that exists. So this solution discovery is an extremely important part that can only be done through tech.
True. More awareness.
More awareness, more of everything, more knowing the solution.
True.
And
more accessible.
I was going to get to more accessible. It could be more affordable. It could be available anytime, anywhere.
At a click.
Absolutely. And as we are looking at creating Solh, and we are looking at people all across in their ability or in what they do, what we realized was, if you are able to provide people with tools, okay, and what we did was, we said people need three kinds of support structures in their lives.
Okay.
Number one, self-help capability. So things that people can do by themselves.
True.
Or things that people can do with the environment, with our platform, in that sense. This is also part of, for a lot of people, this is also part of what they call as coping mechanisms. Second is how they work with community at large.
Right.
Okay, which we call as community support.
Yep.
Now we need to enable it through tech.
Yeah.
So that community support can only be enabled through tech.
Yeah.
Most of our personal relationships now are transactional in nature. They are not meaningful in nature.
True.
Okay, I have this theory about even relationships and all, and how they are transactional, but we don't have meaningful relationships.
I so agree with it.
So the purpose of tech was to give people these meaningful relationships that they can, let me not use the word meaningful relationships, actually let me say totally non-meaningful relationships. But
I like that.
Totally non-transactional.
That's truth. That's the truth.
So that they can gather support in whatever form they want, in whatever mechanism they want. And of course there is anonymity and everything on top of it that's there.
Yeah.
The third is for those 2% people that would need some kind of a expert support. A psychologist, a psychiatrist, a therapist, a counselor, an allied therapist or whatever. So there is that marketplace that is there. So we looked at tech to provide the self-help tools, the community support tools, and the expert services.
Yeah. I agree about that transactional relationships part. I want to hear your point of view about that. What do you mean by transactional? I call them you scratch my back, I'll scratch yours kind of relationship.
That's as well as you could put it.
Yeah. So what's your take on that?
So for me, transactional relationship essentially means there is no depth behind that relationship.
Yeah.
Most of the times, even if I am out there to do something for someone, most of the times people's thought process is, you do this because at a later point in life or in time or whatever, you may need this and this person may provide this for you.
Yeah.
I don't care.
Yeah.
I mean, whenever I go through anything bad with, somebody, most of the times people's response is, you need to learn from, whatever happened. And I said, so from a stupid person, I learned never to trust people anymore. I don't want to do that.
Exactly.
I really don't want to do that.
Yeah.
I'm happy living in this cocoon where I, work with people, help people, do whatever I feel right. I'm not saying I'm an altruistic, philanthropist person, no. But I do what I think is right. I
Yeah.
don't care about what the other person is doing, and I never do something in an expectation that this person is going to come back and do something for me.
Yes.
That for me, the lack of that for me is what people have, which is what I call as a transactional relationship.
Exactly. And I'll just add a little bit to it. That's an area of my interest. So, जिन्होंने हेल्प करना होता है वो करते ही हैं, whether they will get something or not. You get something out of it, great. And if you don't get anything out of it, it doesn't matter, because you did that because you wanted to do that.
You do what makes
And I feel,
you happy.
I have a very simple theory in life. I feel कोई हमको बुद्धू नहीं बनाता. Nobody can fool us. Someone can fool you only when you want to get fooled. And sometimes it's nice to get fooled. That's what trust is.
And
you are
I say
okay.
they are all experiences in life. It's
Exactly.
not good or bad or whatever.
Yeah.
They are experiences in
हो
life.
गया, it's
Move
okay.
from there.
Yeah, हो गया, चलो.
Yeah.
Okay, on that note, चलते हैं next question पे.
Sure.
AI mental health care world को कैसे revolutionize करने वाला है?
Sure.
I'm sure you are already thinking a lot about it almost every day. So share everything or whatever you want to share with us.
First of all, let's distinguish between logical and artificial intelligence.
Yeah.
Okay. Most of the businesses, what they are doing today is simply logical. I see extremely few cases of true AI implementation.
Agree.
And again, I could even go to the next level and say true AI तो कुछ होता ही नहीं है ना. True AI is always more logically built.
Compilation, yeah.
But let me not get there.
Yeah, I get you.
In case of mental health, AI even today and as we proceed, it will play a humongous role.
Yeah.
One of the reasons it will play a humongous role is, unlike other areas in healthcare, mental health of every individual is very personalized. It's unique to that particular individual. So I always jokingly say in my workshops, mental health works in 8 billion different ways. And the number is 8 billion and not 10 billion because we as humanity have not reached 10 billion number. It works uniquely for everyone. So AI in its true sense can actually keep looking at that user, keep gathering insight, information and everything about that user, keep incrementally, keep learning and keep incorporating better logics for that person while looking at everybody else, in terms of big data and everything as well.
Right.
And then personalize, customize and create mental wellness opportunities for that one individual.
Right.
I'm not thinking about it all day.
Right.
We are actually doing quite a bit of that in the platform today as well. Okay. Of course, currently we are self-funded. It's not a request for fundraising, even though if somebody is interested, we are very open to it. But we are currently just scratching the surface on AI.
Okay.
We are currently creating modules that can later be integrated in the form of AI.
Yeah.
So we have a screening assessment area where we'll gather a whole bunch of data about the person based on their inputs. We'll look at what kind of conversations are they doing, what kind of participation they are doing in support group.
Yeah.
While people get worried, let me say, none of this data ever gets shared with anybody. Absolutely not with your organization. Absolutely not with a third party. I have this philosophy that Solh Wellness will never have third party ads. And Solh Wellness will never go out to the level of selling its data about its users. I work in mental health. A lot of people that come to me will come in all sorts of good, bad, ugly, vulnerable and other phases of life. I can't do that. So for us, there is huge amount of AI integration that is happening in that. The fact that we are tech driven, we have whole bunch of tools and capabilities and people are doing variety of stuff. We can use that to improve on an individual's personalized experience. We don't give it out to somebody, but it is definitely something that gets used within the framework to provide value.
Right. Okay. So next one. So what metrics or feedback do you consider when evaluating the success and impact of your app on its users?
Sure. So, first of all, let me say, our core belief is anytime somebody does something on their mental health, even considers, even says the word mental health, they get mental health support.
Wow.
So, what we have done is we have created this approach in our platform where we look at a user's usage of the platform. Okay. For everything that they do on the platform, they actually get points.
Super.
Okay, and those points are differentiated based on different activities, and we have worked with a whole bunch of experts to actually define this point range. First thing that we do is we look at this data. What are the number of, we call it PsyCap. So PsyCap meaning psychological capital. So we look at what sort of psychological capital has been generated by this individual. You know, or if we are looking at a group by this particular group, or if we are looking at the entire platform by this particular platform, what kind of psychological capital has been generated.
Okay.
That's point number one. Point number two is we look at in every aspect of the platform. Okay. For example, in screening assessment tests, what is it that people's test results were? What were they over a period of time? So 3 months back, maybe X number of people said they are under stress. Has that number reduced? Has that number increased? How is it proceeding within the organization? And there are a bunch of different screening assessment tests, nearly 20-25 of those that are there on the platform. So people are able to use them. We would look at what sort of conversations are happening in this feature that I called as Talk Now. Okay, we actually create this tag cloud saying here are the important keywords being used in Talk Now.
Right.
Okay. We look at what sort of support groups are people joining. And what's going on in those particular support groups, what sort of conversations are going on in journaling, what is it that people are saying in their mood meter. So we look at all of this data to gather insights on how is it proceeding within an individual user, within a group, within an organization or platform overall.
Right.
And this data can be, can be bifurcated in variety of different levels to get meaningful matrices out of it.
So how do you evaluate the impact of all these activities on the app?
You combine them using AI.
Okay.
Or let me not use the word AI.
Right.
You combine them using big data. You get a lot of insights into what sort of work is happening, what sort of psychological capital is being generated, what sort of conversations are there, what is it that people care about the most. So you start getting data and everything from there.
So that helps you understand that you've been able to help its users?
Absolutely.
Okay.
Over a period of time, what would happen is AI will continue to evolve, and there will be an implementation of a chatbot, there will be an implementation of a personalized experience, and all of that would happen. The third key trend that I see, and again it will differ from country to country. Okay, India has very different maturity in terms of health insurance overall. Forget about mental health insurance. US has very different capability, and different parts of the world would have different growth path in that.
Yeah.
But what would happen is mental health will become one of the most important aspects of healthcare. I mean, it's almost like I remember going to Singapore General Hospital a year back, and I said, how about I work with you and I work with your cancer patients. I provide my platform to your patients and your caregiver, and I'm able to reduce their hospital visit by 1 in a period of their life cycle, which is usually 5 to 10 years. For a cancer patient, either to recovery or to not being there anymore, but it's 5 to 10 years. How about I reduce their hospital visit by 1, just 1, because they have better mental health support, because they don't need to come due to anger or due to uncertainty or due to fear or whatever, by 1. Think about what does it add to your healthcare system, what does it add to the patient welfare, what does it add to your capacity increase in terms of your ability to handle more people. And it's staggering, right? So mental health has a huge integration in every part of an individual's life, and I see there will be a lot more appreciation of that as we move along. Okay, already schools, colleges, corporates, healthcare organizations, everybody has started thinking about it in a meaningful manner. I expect that to continue to grow. One other trend which I want to be in the center of as it increases is, people get healthcare discounts because they are non-smokers. Because they are non-drinkers,
Yeah.
because they are drug abusers or substance abuse or whatever other aspects.
Right.
Why won't they get better insurance policy or discount on their insurance? They take care of their mental health. So I want to integrate. So when we created this measurability system on that, we said maybe this system will become a reason for an insurance company to say, oh, you have 1,000 or 10,000 or 100,000 or whatever number points here. So you should get X% off of your health insurance since you're taking care of your mental health. And for somebody else, it's not there. And then look at it at a group insurance level, looking at organizations. So we think there are some fundamental changes that would happen in the mental health industry over the next some time.
Very interesting. Yeah.
And we want to be bang in the middle of it as it happens.
All the best.
Thank you.
Okay. So, Kapil, आपको बहुत सारे डिसीजंस रोज़ लेने पड़ते हैं. Yeah. So, what is your way of doing that? So, do you kind of just decide spontaneously on the spot, or is your process like thorough analysis and then take your time and then do it? I mean, how do you usually make your decisions? Is it something spontaneous on the spot, or someone who kind of does a thorough analysis and then says okay?
So let me first of all say, instead of talking about how I make those decisions, let me first say there is an approach in my life, in my company, and people that work for me, with me, or even above me. I have always had this approach. The problem in the world doesn't come from the fact that you make bad decision. The problem in the world usually comes from the fact that somebody in the system thinks it's a bad decision, somebody thinks it's good, and they don't work together to make the best out of decisions.
Wow.
How we have created this in my structures is, firstly we say, if anybody has a problem with the decision, speak now, or not even forever hold your peace.
Yeah.
Speak now, or from today onwards it's your decision as well. I hate, and in my structure now nobody does that. I hate people coming back later and मेरे को तो पता था ऐसा ही होगा. अरे, what the hell were you doing when everything was going on? Why didn't you? The fact that they are saying this essentially means they were never part of the implementation of this particular decision, and they were just waiting for it to fail. The decision once made has to be the decision for everybody involved.
Right.
That's the first part of, and we are very clear on this.
Great.
Okay, it's everybody has all freedom to speak up when a decision is to be made. And what we have done is we have created a matrix, almost like it's almost scientific in nature, around how decisions would be made in the company. And I always tell people the things that I am responsible for making decisions on. I am not responsible because I can't make a bad decision. I am responsible because the system thinks the probability of me being right is more than you.
Yeah.
It's as simple as that.
Right.
Will I make terrible decisions? Of course I will, every once in a while. Okay. But the system thinks probability of my decisions being right is more.
Yeah.
Is why I have been given this role.
Right.
And we have created a scientific process in how it happens. In fact, we have gone down to the level of implementing this thing in our structure. We call as third party opinion. So if one person ever disagrees with another person on a decision, and I mean, I used to run a digital marketing agency, so it could happen over a piece of creative that is getting done for a customer. Right? Somebody says it's great, somebody thinks it's terrible. We say don't accept the other person's point of view. Go to a third person and seek an opinion. Either this person will get convinced or this person, however. If you don't, go to the next level. Till the point you reach the last person, okay, and that person has to be the decision maker.
Right.
And then, simply accept that person's probability of making a bad decision is lesser. So it takes away a lot of capability from people. It actually takes away a lot of capability, not adds a lot of capability. It takes away their capability to blame the system for failure. It takes away the capability for them to come back and say, I wasn't aligned to this to begin with. No. You are part of this. If you didn't say you don't agree with this, okay, then you agreed with it.
Exactly.
Okay. Even if you said you don't agree with it and you went up and eventually the decision gets made.
Silence is a soft yes.
Yes, even if you go there and the decision got made, now it's the decision for the company. Do whatever you can to make it successful. If it fails, the system has failed. It's not the individual making the decision, and you haven't succeeded because you thought it's wrong. So, and we have done this, as I said, we've done this reasonably, let me not even say scientifically, we have incorporated it as part of the culture of the company.
Nice.
And I wouldn't say it works perfect all the time. I wouldn't say everybody uses it all the time. But we have tried to incorporate that kind of a structure for us.
Maybe not everyone's using that ticket.
So in that sense,
up to them.
For me personally, most of the times I would hear something and there is something that will trigger,
intuitively. Gut feeling, use whatever word.
And then I will go look at data and analysis and this, that and the other and talk to people and figure out and whatever. And I do this both ways. When I am advising people and when people are advising me. Me advising a person has absolutely no intention, and I don't have any expectation that they will take my advice. I give advice saying, here is what I think. Now you take it, leave it, do whatever with it. I won't come back second time and say, I told you this and you didn't do, I won't give you advice anymore, or I knew it will fail. No. I give you advice, you chose whatever was right for your life. And that's what I follow the other way around as well. People give me advice, people say things, I would listen to them, I will contemplate them, and then I will do what I think is the right thing.
Now let's move towards TVMS special segment. Yeah. So हमने बहुत सारी बिजनेस की, टेक्नोलॉजी की बातें करी, सेल्फ अवेयरनेस की. नाउ लेट्स टॉक मोर अबाउट my favorite segment. Yeah.
Okay.
So I want to hear from you, what is your definition of love?
Simply put, respect and care.
Nice. Okay. And if I ask you to define joy, how will you define joy?
I can only define joy for me.
Yes,
so,
that's
like
I want your definition of joy.
So I want to put a disclaimer. My definition of love, joy, or whatever else you will ask is purely for my life.
Exactly.
Okay.
It is your section.
Yeah. So when I said love is respect, love is trust. Okay. It's simply that for me. I mean, I don't believe in this concept of love at first sight. I don't believe in other aspects of it. I'm clear that's how it is for me. In terms of joy, joy is for me simply doing what I love to do, which is what I do almost all the time.
Nice, interesting. Your number one source of joy?
My work. Simply my work. Okay, doing what I'm passionate about. And really, that's what I end up doing most of my life.
So let's move to the rapid fire section.
Sure.
And it's rapid, right? And your answer cannot exceed a phrase.
Okay.
Okay. One word or a phrase.
Okay.
Right? So, do we shoot?
Sure.
Okay. Dish kya? One. Empathy.
For people I care, yes.
Cool. Dish kya? Collaboration.
Everywhere, every time, with everybody.
Super. Dish kya? Weaknesses.
I'm not sure if I could define a weakness for myself. I like myself in almost everything that I do.
Alright. Okay. Still, if you had to say one phrase for weaknesses, what could you say? Even if it's a philosophy, what could you say?
Sometimes I lose my own set, let me not say morals or ethos, but my own set value system.
Profound. Dish kya? Failure.
Whenever I have not questioned or whenever I have not really followed through on what I decided.
Dish kya? Decisiveness.
Oh, I'm very decisive. I decide, I move forward, and I don't look back.
I'm going to kind of shoot a few words, right? And you are going to, these are not just words, they signify the values of your life. So how would you rank these values in your life? Yeah, so your baits are money, love, happiness and health. So rank them in the order of importance, most important to least.
Health, happiness, other two I don't care about.
Love and money, you don't, okay, let's give them some order. They are not replaceable for sure.
I mean, yeah, I'll still struggle with putting one above the other or putting one below the other. They are unimportant.
In this moment, what would you put first? Just in this very moment.
Yeah, that's what I'm saying. Neither. I don't have personally, I don't have much care for love and I don't have much care for money.
Okay. So, I can just kind of, you want me to remove both the words from as values? Shall I remove them as values?
That's what I was saying. That's where
Are you sure?
Yeah, that's where I'm kind of.
Well, when you say you are a passionate person, it means you have love.
For myself and for work I do.
So, why aren't you putting love anywhere in the scheme of things?
Yeah, when people
I do a chota sa podcast called Planet Love, where we talk about everything love. And when we talk about love, love is not just wo relationship wala pyar. Love is everything. Love is what you have for your work. Love is what you have for anything at all under the sun.
So in that sense, you could say love.
Yeah.
But it would clearly be that.
Yeah, of course. It should clearly be that. It should. We don't discuss such a personal love on our podcast.
By the way, I should come to that Love Wala podcast and talk about what I wouldn't talk about here, my 4 people theory.
Yeah, okay. We'll talk about it.
Yeah, for a different podcast, for a totally different kind of a discussion.
We'll do that.
Yeah.
We'll do that.
And we don't talk mental health there as much.
Yeah, of course not. We'll talk only love then.
Sure.
And love has got nothing to do with health. Yeah. Okay, so I am making it like health, happiness, love and money. And if you're talking about the kind of love I'm talking about, would you like to put love first? Just asking.
I'm okay whichever one you put first.
It is your, your
health,
segment.
happiness, love, money.
Okay, got it. So before you go, I really request you to share with their audience, and most of our audience are aspiring leaders or leaders themselves. So I would like you to share with them, or maybe call it your message. So what advice would you like to give them so that they can make an impact in their own lives?
3 things that I would say, and this has been a lot of from the conversation that we just had. Number 1, be clear on what you want in your life without giving a care for anybody else, and I'm including your family, your parents, your spouses, your children, everybody in that. First, be clear on what you want in your life.
Right.
Number 2, money. And I'm saying this from my life, how I look at it.
Yeah.
Money, unless you are poor, and poor meaning, you don't know where your next meal is going to come from.
Right.
Money doesn't really matter as much, at least in my life. It doesn't really matter as much.
Yeah.
I don't do my businesses or my work to earn more money. Okay. There are 50 other things that I could have done to earn money. I don't, that's not important.
Exactly.
Please, for me, if you can look at it that way, I think you can achieve a lot more, and more importantly, I think you can earn a lot more money.
Right.
Number 3, surround yourself with people that you match with. Okay. And if I have to do a bonus for what I was saying earlier, ensure you care for people that work with and for you, but only those people that do good work.
True.
Be ruthless, at the same time be extremely caring.
So this is my personally favorite section, the final section of this podcast. So I love to hear good things about everything on this earth. So why not the Vasudha Madaan show
Sure.
and Vasudha Madaan as the host of the show? So I want you to say something nice. See, I'm telling you, you're only allowed to say something nice about the Vasudha Madaan show and Vasudha Madaan as the host of the show.
Sure.
What would you like to say about
Sure.
it?
It's actually been a wonderful experience. I mean, we met 3 weeks back at the Republic TV event.
Yes.
It's actually been an amazing experience for me over the last 3 weeks. The approach with which you connected with the team, with which we set up the first time, and I understand it got cancelled, but things happen. I mean, I don't think I even cared about it as much. It got cancelled because you had a personal tragedy or a personal incident that happened. And that's fine. We wanted to reschedule, we rescheduled it. The entire demeanor, the entire approach, the entire format of the show. I mean, I think it's wonderful. And I'm saying this not just as somebody that has gone to multiple different podcasts and multiple different shows. I'm also saying this as somebody that runs a lot of different podcasts and shows, both for my mental health venture as well as for my other business, which is the Frontage Media.
Superb. It means a lot.
So
This is coming from you.
Yep. So you're doing a wonderful job at that.
Thank you. Thank you so much.